show the big hair. It's not. Oh, I'm gonna be quiet.
All right, welcome back. So we are now going to talk about health and wellness, which we've already been talking about health and wellness goal. And we've got Liz Esterbrooks, prior Army, but also you know her if you're involved, were involved or are from Oregon as a woman veteran, and also she spent some very important time working at the Center for Women Veterans as the deputy for several years, and she's also the one that's guilty for I'm Not Invisible, which is a program she started. And so Liz, welcome today. And then we have Navy Captain Cynthia Macri, and she has a very interesting background. So in addition to the medical side, she also worked in the DEI side, diversity, and at a very high level. And so when we talk about health and wellness, you both have programs that you did individually as veterans, or like Cynthia will tell you about her glass torch work, which I'm very challenged at. But you know, incorporating not only getting the health we need as we age, as veterans, and the 3-generation family, I love to put that picture of them up, because it's like, you have, you know, the grandmother that served in 1944 to 1947, all the way to Christina, and you served and medically retired in 2008, right? 2009, thank you. So we have this long window, and in just one family we can see what the health changes and needs are, and the VA needs to, and is trying to capture that. And so what's out there, what surveys are happening, how are those surveys and the research released, and what do we know as women veterans, and what's available for health conditions we should be monitoring, and if we have civilian providers, how they get that information. So that, I mean, that's a mouthful.
I'm
So
sorry, just listening.
So I hand it over to your capable hands.
So do you want to go first?
No, she's the adult in the room.
So I started working with women veterans in 2011, and so my specialty became women veterans, and I spent almost 30 years working in the field of domestic violence and sexual assault.
Your thing needs to
is
be
it
on.
not? What's the matter?
Do you have it turned on?
Where's your?
Oh, maybe not.
Unmute yourself.
Okay, can you hear me now? Is it better? Okay. So I spent 30 years working in the field of domestic violence and sexual assault, and so I became a subject matter expert on that. So military sexual trauma by association became my focus when I started working with women veterans. But it's not, sometimes when we talk about women veterans and health, we hone in on military sexual trauma. And I want to be clear about something. It's a misnomer to say, did you experience military sexual trauma? You didn't experience military sexual trauma. You experienced harassment, rape, or assault. Military sexual trauma is what you have now because of those experiences. When we ask people, did you experience military sexual trauma? Too often we get a no, because they see that as, I don't have a diagnosis. I don't have military sexual trauma. Military sexual trauma didn't happen to me. But if you say, did you experience harassment, rape, or assault? They'll say yes. So we have to start by changing our language, and that has to do with when we talk about health and women in general, women veterans. We have to say words that matter and that mean something, not to us, but to the people we're talking to. And last night, Mary was talking about person-centered care. And person-centered care is something that really has been missing from VA for a long time. If I had stopped going 20 years when I had my first really awful experience, and if I had stopped going in 2013 when I was assaulted, I wouldn't be advocating for it today, and I wouldn't be getting the good care I get today. So I think it's important that we recognize that while there are still failures with health care for women in the VA, and I'll give you an example, a woman, my doctor in Portland, she was talking about, because women have to so often be outsourced to the community, that it's difficult for doctors, and she was talking about pelvic, what's it called, the pelvic floor and pelvic, what is it called?
Yeah, pelvic floor dysfunction.
Yes. So thank you to the doctors in the room. But she said because women have to be outsourced, it's difficult for us to work together as a team that we should. So there are some failures that still unfairly burden women veterans by using the VA. Mammograms, like all kinds of stuff. So I think that when we talk about health and wellness and policy, we have to continue to push and talk about that. And it's not a matter of DEI, it's a matter of gendered care, making sure that we are getting the heart examinations, making sure that we're getting the tests that we need. If it takes a genetic test, whatever it takes. But there's also assessment disparities. So for instance, in TBI, there are a lot of women who have TBIs. But what a lot of people don't realize, including medical providers in the VA, is that the majority of TBIs that women experience come from a personal assault, domestic violence or sexual assault. And the majority of TBIs that men experience come from car accidents, being dumb, being in a combat situation. And so the initial assessment asks 4 questions that determine whether or not you go on to the next step of the assessment to determine might they have it, if so let's move forward. And so those questions on that initial assessment don't include, were you ever assaulted? Do you have this experience? So TBI, and we were talking about this earlier, when we think about things like TBI and erectile dysfunction versus FSAID, they say, they tell women that's part of your PTSD, that's part of your psychological problem. Whereas it's a medical condition, but with as medical conditions. So we can't stop focusing on the disparities of care. And those disparities can also happen in the civilian population in hospitals. I used to train doctors and medical providers and say, you have to start asking women if they served in the military. Because if they're coming into your private office, you need to know that they have this experience, and you should be screening everybody who comes into your office for this. So I think that's a real concern that I have been talking about for several years, is how do we make sure that women are getting equitable care that men are getting? It's a gender issue. When women are having separate assessments for their health conditions and being denied benefits for the same conditions. Mm-hmm. Women have historically been denied many things. They were denied military sexual trauma claims, and one of and I don't want to just focus on military sexual trauma, but I will say this when it comes to the disparity. It's a concern that veteran service officers too often only focus on PTSD. And I used to always say when I trained veteran service officers, rape is not sex. Let's be very clear about that. It's a violent act and a violent assault that leads to medical conditions, physical health medical conditions. So when veteran service officers are filing claims, when we're going to a veteran service officer and they talk about MST, they are only talking about the psychological aspects of it. So we advocating for ourselves and saying, yeah, but I also have these medical conditions that resulted from that assault. And part of that is advocating ourselves. Part of it is knowing the questions to ask and knowing the answers that we need to get to those questions. And so I think that is a good part of it. When we talk about denied benefits, combat exclusionary policies set women back terribly in their benefits because legally women weren't in combat. So women like the Lionesses were coming back and they were being denied benefits because they were told women aren't in combat, we can't give you combat-related benefits. The VA and DOD are separate entities, but in many ways have now. If you have post-traumatic stress, if you have bad knees, if you have a bad elbow, and most importantly, you don't have to have been in uniform when these things happen. You just have to have been on active duty. So if you're riding your bike and you hit a pothole and it's after duty, and you break your elbow and crack your skull, you can today apply for service-connected benefits for those health conditions that you have. But a lot of people think while I was in uniform. If it didn't happen then, it didn't happen. But remember, when you're in the military, it's 24/7, right? You're never off duty. And so again, when we talk about health disparities, it ranges from the time we joined until, if it's 70 years later, whatever it is, you're never too old or too young to apply for your benefits, and it's never too late to advocate for yourself when you go to the VA, or if you're getting bad care. If you're being sexually harassed in the VA likes to put out these surveys, and when we talk about data and research, I, having been at the Center for Women Veterans, can tell you that we can't trust their numbers. When they say women and LGBTQ veterans have this high of a satisfaction rate, it's the way that they're asking the questions and the way they're interpreting the data. So, for instance, they have their survey data might say women are. This is the woman's. I'm sorry. Oof. This is how the women are satisfied, and this is the men. But what they're doing is and I found this out from Veterans Experience Office when I was in D.C. They literally only had 17 LGBTQ veterans that they surveyed, and they were comparing those numbers to 1,000 men. And they did that with their homelessness. They do it with everything. They don't weight their data, so it's really not trustworthy data. But if you're doing work with women veterans, you can contact, if they're still doing it, I don't know, the Center for Women Veterans. We developed a very solid, we used Booz Allen Hamilton consultants. There's a great survey out there. When I left, it was 18,000 women who had taken the survey, and that's a good number. And so anybody, if they're still doing it, can contact the Center for Women Veterans, because we made sure that it could be distributed by or analyzed by state, by era, by LGBTQ status, by many things. So if you're in one state and you want to know what's the information for this state, you can get those numbers from the Center for Women Veterans, if they're still doing it. So, but that's if you're an advocate for women veterans, if you're doing any of that work, contact them and say, hey, I'd like to get the survey data for my state, or for the whole United States, for whatever it might be, for the women's survey. And so I think that's about all that I really wanted to talk about at that real high level. And I'm going to let Cynthia give you some more. She's going to drill down a little bit more.
So that being said, the major issues that still face not only women veterans, but as a nation, right? There's still some major health issues. And remember that veterans in general and women in particular are a marginalized community. So we have been pushed to the margins because our numbers are low. So as an Asian American, I have always had my stats, I had my stats bunched in with other, right? Because the numbers are too small for statistical significance. So you're either white, you're either non-Hispanic white, you're Hispanic, or you're black, or you're other. So I've always been other, right? So, but women veterans in general are also considered a marginalized community. So what issues does the nation face? One is access to care, any care, right? Because we have a physician shortage. Why is there a physician shortage? Well, the cost of medical education is prohibitive. I did the scholarship route because I couldn't afford it, and medical school is $8,000 a year when I went to medical school in 1979. So access to care, and that also tells you who is becoming doctors. Doctors are people who can afford college and medical school in general, right? So what percentage of those doctors had the same experience as your troops, as your enlisted people, the whole base of the military, right? So without those shared experiences, you have to work on empathy as opposed to have lived it. So there's access to care, but it's also access to compatible care. And then there's access to specialty care. So when Dr. Christie and I were in the military, we bent over backwards to get our residents to rotate on internal medicine so that they could learn about blood pressure. They could learn about immunologic diseases or diseases that are the bailiwick, basically, of internal medicine doctors. There's no such comparison in the internal medicine training pipeline where they learn about obstetrical care or gynecologic care. And that's the people that are taking care of women in the VA. So there are some VAs, like Albany has one OBGYN, but she's a solo provider. She's a great person.
It takes months to get in.
Solo provider, which means she can't take vacation because there's nobody to back her up. So those are the types of things, and there's no maternity care in that hospital. So what ends up happening is that we as women veterans disproportionately receive fragmented care. And when you have any of you had a referral, you send your referral out for either mental health or I have physical therapy, I get 15 visits. That's it. Then all of a sudden my chronic osteoarthritis magically disappears after 15 visits. I go back to the VA, get another referral, and I'm referred to the next community care provider on the list. I have to go back and say, no, I want to see the same physical therapist, so I don't start over. And then I was told that I had to go to get a different modality. I had to get acupuncture before I could go back to the physical therapy, my same physical therapy. So this is not good care. It's called fragmented care. And so for OBGYN, that we need to have, women deserve and have earned access to an OBGYN doctor. So what they've done now in the VA, which there's high satisfaction, just ask them. you get to see an internal medicine doctor who has done, get this, a 4-day boot camp. So I asked them the question, I said, so what did they learn in that boot camp? Like, can they place an IUD? Because that's a big deal for women in reproductive age group, right? Long-acting reversible contraception. They can't provide us an OB doctor, so maybe we should get contraception to prevent. But anyway, they don't do that, right? So they can talk to you about it, but they can't actually perform that. So now I see a person with women's health in the VA, but I still have to go to the outside to have any procedure performed. Now remember, in many states today, there are lots of procedures and lots of medications that you can't get. So it's geographic disparities as well in terms of what kind of care you can get. And the other thing that the VA does is that they pat themselves on the back about the fact that they have women's health navigators. Okay, these are not doctors. They're in general, nurse practitioners, PAs, et cetera. They have a lot of training, that's true, but they don't have the connections that we have. So as an OBGYN doctor in the DC area, I can call Inova Fairfax. Half the people there we trained, right? so we know these people. We know what board certification means. We have gone through the process. I know if you need pelvic floor if you have pelvic floor dysfunction, I know who to send you to. Not just the next generic OBGYN on the list of referrals in the community care network, right? And so that's another disparity. And then the last thing I'm going to talk about is mental health. So we separate out the mind from the body, right? But in many cases, what's going on in your body is either a reflection of what's going on in your mind, or what's going on in your mind is a reflection of what's going on in your body, right? They're not disconnected. So we need to be able to access mental health care. We need to also be able to access gender-specific care or person-centered care. And and that's not exactly the way things are provided, because what we do in the DoD as well as in the military is we like to collect data that we can measure. It's too hard to think about to get data that we need. So we do what we can, and we used to call that butts in seats, right? I delivered this program to 2,700 people. Yay me, I've been successful. It doesn't matter what they learned or who else needs to hear it. What we tend to do is the metrics we collect tend to be only those that we can easily measure, and that butts and seats is how many people were there in the room. So the last thing I'm going to say is what I've learned in the last 3 years. So I left the Navy in 2014, and like many people, like many veterans, the transition was you. I could have applied for that job and said, but I didn't want to do healthcare in the civilian sector because I'd been in the military my whole life, and I really liked having access to my OBGYN, right? So I didn't want to go do that. I also have arthritis, so I couldn't operate anymore. And it was hard, to transition. So I started volunteering because helping others is very good for your mental health. So I got involved with a lot of veteran programs. But it wasn't until a fellow veteran dragged me down to the glass place, and I learned how to do flame working. So these are so I used to say to students and people, I used to say, I'm going to leave you with 5 things. Well, now I'm over 65, so I'm down to 2 things, because I can only remember 2 things. So these are the 2 things. One is, you are your first and most important physician. You. Why? Because I have 30 minutes to see you. And I'm lucky to have 30 minutes to see you, right? Because I'm a cancer specialist. Most people, primary care is 15, right? Who is taking care of you and your physical and mental health problems or conditions the other 23 and a half hours, 364 days of the year? You are. So what can you do? And the other thing is, remember that your food is medicine. And if you don't treat your food like medicine, your medicine will become your food, right? That's very true. And so what does that really mean? That means that we, as individuals, we have to actually think about what we are doing to improve our microenvironment, whether it's decreasing stress, sleeping more, meditating, doing things that make us happy, give us joy. So think of the word joy and think of the word gratitude, because that's kind of what we have to do in our tiny little corner of the world, is find those things that give you, that make you happy or give you joy. And you as a person, if you are happy, your environment or your people around you will also benefit from that. So to me, doing glass is something that's very meditative, and I will sit there with my torch blazing in front of me, especially if I'm near Anne-Marie, and with my molten rod of glass. But remember, that glass will move the way it wants to, but I can control it by moving it out of the flame, putting it back in the flame. If it cracks, I can heal it. So it's damaged or it's broken, but I can fix it by putting back in the heat, right? So we always think about I'm in the heat. It's like my feet are in the fire. Yeah, but that's what makes you stronger, right? And so the glass is a very good metaphor for survival and for thriving. So I'm gonna move, get off my soapbox and move back to the adult in the room.
I love Cynthia. So we had the pleasure of working together when I was at the center, and she joined the advisory committee, and we were just like, I see you. But I want to. She made me think of a few things. So when we talk about access to care, we tend to think, we still have, as veterans, we still tend to have sort of that military mindset, like we can't question. But I just want to make sure that all the women listening here and on the screen understand that you have the right to change doctors. You can say to the VA, I want a new doctor. And I think there's a 1 year, I think you can only do that once a year, but you can in fact change doctors. Also, a lot of women, in my work, I have found that all women experienced harassment, assault, and or rape in the military. And so many women don't want to have a male provider. They don't want to have a male mental health provider. They don't want to have a male physical health provider. And when I was at the center, I talked a lot about how that's a barrier to care. Because if you're assigned to a male doctor, you either may not go to your appointments, or you're not comfortable with your appointments, or whatever the case might be. I made it clear for years I wanted nothing to do with a male provider. And when I was going through, when I had my little snap in DC, and thank God for Anne Marie, have a battle buddy you can call, especially when you're in a mental health crisis, and Anne Marie was mine. And but I understood that it was a problem for me to see certain doctors. And so my psychologist, who was a wonderful woman, recommended that I go on some drugs for the stress and the depression and the anxiety. And so she couldn't get me those, but she sent me to a psychiatrist, and she said, oh, he's wonderful. I said, no, you know how I feel about men. And sure enough, when it was a phone interview, and he implied that when I was being harassed in the military, that I didn't do enough to stop it, and that I should have done better over the years. And I said, you are way outside your bounds. And I said this to him. I said, you have no right to talk to me this way, and I'm hanging up now. And I contacted my psychologist and complained. And she said, would you like to file a formal complaint? And I said, absolutely. And I said, and this man needs to stay clear of anyone who has had sexual harassment, assault, or rape in their history. He has no business talking to anybody who has been in that situation. I filed a formal complaint, but I never heard anything. But I think we need to make sure that it's clear in our records, I will only speak to a woman. I will only go to a woman. If that's what you want, stand your ground. You know, VA, too often, they have male providers in the women's health clinics. They offer only male providers, but push back on that. And make sure you let them know, I will not see a male provider. I won't see a male mental health provider. I won't see a male physical health provider, because they will back down, and they will say, okay. And they might say, it'll take a little longer for you to be seen, or you can be seen in the community. Okay, that's fine too. I'm okay with that. But I never want to sit in front of another man in my life who is a medical provider. And when I go to the community, I make sure it's the same. Now, I did cave on the neurologist. It's damn hard to find a woman neurologist. and so he came highly recommended. So, and it's been a wonderful experience with him. So sometimes I do back off. I don't take a hard stance, but when it comes to mental health and physical health, other than my neurologist, I stand firm on that. And I think that women really need to hear that they can take that stand, and it's okay. And the VA will back down, and they will give you what you want. You're your own best physician. You're your own best advocate. And too often we aren't willing to advocate for ourselves.
We'll advocate for others.
Yeah.
We're very good at advocating
it's
for
right.
others.
Yeah.
But so here's my question for you, both of you, is what can be done to improve the community care people that we get sent to? What can be done? You know, you have Lieutenant General Patty Horho, who went to 43rd Surgeon General of the Army. She sent, by the way, for people online, she was so generous to give us the Women's Valor Pin. But she went, and she's out in the world now working with United Healthcare Group, started their federal Optum. And I'll tell you, I go to meetings quarterly with the CEO of United Healthcare Group's federal program. And they say, how can we do better? Yeah. How do we help these organizations that want to help and are maybe contractors to the VA? How do we help them better help women veterans?
It's the It's the origin. So the problem is the gatekeepers in the VA. The civilian sector, has providers that can provide that care, and they are vetted to some extent through the community care program. But just for the record, the community care physicians sign a contract that says they will be satisfied with getting Medicare reimbursement. So it's not fee for service, it's Medicare reimbursement, which is it's between a half and maybe 2/3, if you're lucky, of what the fee for service is. So you're already getting people that either have a passion for serving veterans or they are, settling for whatever reason for a permanent stream. It's on. Oh, yeah. For a income stream that's reliable, but it's half of what fee for service is, right? So that's the one thing about your community care providers. I like to think it's because they're, passionate about serving veterans, but it's probably not the case. And then, but the other thing about that is that who sends you out? So I would just want it for all women, you can go to www.acog, ACOG, American College of OBGYN.org, acog.org. There's tons of information open to open to the public. Obviously, lots of it is behind the the paywall, but you can find some information on that. The problem is in the VA and many systems is that the person that's sending you out has not a clue about what you need. They see on the referral that you need, a neurologist, or you need a mental health professional, but they don't care what kind of mental health professional you get or what that person's experience is because they don't know. They're just somebody
Making an appointment.
Yeah, it's a navigator or something like that. And so even for the women's health, the navigators are not connected to the academic centers. They're not connected to, who are the good doctors in this? Yeah.
I was just going to ask that because as I personally have experienced, I'm having trouble with applying for Social Security disability, having problems with unemployment, there's no resources that are either up to date or actually helpful for us to access these things. And I'm just wondering, is there any national database for this or?
And I'll interject here. If you have any questions about anything, benefits or entitlements or anything, the best person for you to go to in most cases is a veteran service officer. They don't just file claims. They assist with many things. If you're struggling with generally not VA, but with benefits or with questions like Social Security or whatever, most of them have that skill set that they can help you. They can say, here's the person, do you need help with housing? Here's the person in your community you can contact. Do you need help with Social Security? Here's the person, the veteran, and I prefer, and I have to be careful, I think like DAV and VFW and American Legion, they have some wonderful people. But the problem is that if their volunteers leave, you may lose whatever headway you've made on your claim. County veteran service officers they have bosses, they're steady, and if they leave, there's somebody to step in and take their place, and your claim doesn't get lost. And those veteran service officers are required to be accredited and certified, and they have a certain amount of education they're required. But if it doesn't, if you always interview your veteran service officer, you don't have to sit with the first veteran service you come upon. You can say, have you ever handled a claim for TBI in women? Have you ever handled a claim that's about MST? Do you have the ability? And if you have, how many times have you been successful? So interview them, know that you don't have to go with them just because they're the person you're sitting in front of. You can say, you know what, I'm gonna move on and find a different veteran service officer. So I think that
There's more assistance on the civilian side of us.
unfortunately there's not. There's
State resources,
that's
county
why
resources,
And that's why I recommend the veteran service officers, because their job is to help veterans, and they're usually very good at it.
I'm not trying to make this about me. I'm
No.
saying I know there's other veterans,
Right.
specifically women, that are in this situation, and we don't know where to go.
That's why I recommend the veteran service officer. They're civilians, but they may not all be veterans, but their number one focus, they have one job, and that's to help veterans. And I think that's the thing to do.
I don't have a question. I want to put in a plug for Smith Center for Healing in
Yes.
the Arts, which is, if you're in a crisis, this isn't the place for you. Smith Center, it's smithcenter.org if you want to look this up. It was founded to provide help for cancer patients and their families. It's everything you've been talking about. You can find, we have meditation classes, we have yoga classes, we have art classes. There's a beautiful professional art gallery connected with it. It's located.
Which we'll be exhibiting in, Uniting Us will be exhibiting this fall, so send your art submissions in.
Nice. And that reminds me, I wanted to talk about apps. There's always an app for that. And there are some very wonderful VA apps for veterans. There's some that are specific to women. There's some meditation apps. There's one that's specifically for MST. There are some for sleep. There's a huge number of apps. There are some that are for couples. And so go look at VA apps that are available to you, because there's they have spent a lot of time developing these apps so that veterans have access, because sometimes it's nice to have, a meditation app, or to know about, like, there's some mental health app. So I think it should be a big part of what you're letting people.
Maybe we should talk to Lisa about.
Right, so Lisa Sims Booth is the executive director, and the Smith Center actually has worked with Walter Reed for years, and the COVID kind of messed that up. But they have online classes, and it's not just the Smith Center, right? It's organizations that are out there providing community support, resources for everyone, to include women veterans. And so some of the hang-ups that we have with the treatment or the care that we get when we're around other veterans, we won't maybe experience because we're dealing with the civilian population.
Right.
So I think that there is value, and Annette, I think, and to your point, Liz, we definitely need a way to identify good apps, organizations that are out there. I'd never heard of a county veteran service officer.
Oh, 36 states have them.
I think we filed my complaint.
Yeah.
So
It was a county center service.
this information needs to get out,
Yeah.
and people need to provide us with information. You both started and you had examples of different care situations, and there's congresswomen and men and they take the stories and they take them to the floor, but we have to provide them.
And the House Veterans Committee, I know this, I've sent a number of emails. They get back to you that Mark Takano and Julia Brownlee and such may not, but they have people, they have assistants, I don't know what their titles are, who will get back to you, and they'll respond, and they might even say, let's set up a call. So I think making sure that you don't hesitate, and I can tell you this, that the Center for Women Veterans, you can go onto the VA website and you can send emails to the Center for Women Veterans or any office. But here's a magic phrase that will get them to respond to you immediately. My next step is to contact my elected official. VA hates that. It makes them crumble so quickly, because what used to happen is a woman would send one of those emails to the White House hotline or to the Center for Women Veterans, and I would get an email that said, uh-oh, you need to contact them before they contact their elected official, because we don't want, or to say, I'm going to contact the media. Either of those will trigger immediate action from the VA. So,
It's good information.
Our next question over here. We have a few people I know have questions. I'll make sure we
Okay.
get to.
We have 3 minutes for this session, and then we can continue. after the break.
Oh, I don't want to take a. Oh, okay, I had so many thoughts, but no, my name's Lauren. I actually work at the Washington D.C. VA Medical Center. I'm on the executive leadership team for mental health, and I mostly work with our folks who have serious mental illness. I'm going to save time, but I just want to echo a lot of what I heard.
And she's a veteran.
Oh, yes, Army veteran. Yep, I was a behavioral health officer, so I've done this my entire career: 13 at VA, 6 in the Army. So I just want to address some things. Every VA, one VA is one VA, and it's like a puzzle. Some of the VAs have got the puzzle perfect, and some VAs, they have 3/4 of it done. But we all have the same pieces, it's just they're not all connected the way that the really nice done puzzle is, okay? So I can only speak for my VA, and we have a patient advocacy service, so even if you call the White House, your congressperson, it'll trickle down to our patient advocates. And then your request is sent to your service line, and you'll get a new appointment within 7 days. You'll get your consults expedited. So, and there's a team of me in each service line that does that. So I don't want anyone to feel like dejected that people aren't looking at the concerns. But we also do put we used veteran-centered care for everything. So when someone wants an appointment and it's feasible within our staffing to get them an appointment with that provider, we will try, because some female veterans have experiences that they don't want a female provider, or some have had luck in the past with a different type of provider. Going into community care, I think that was brought up earlier. The biggest obstacle to community care is that we don't have, VA is technically saying, here, we're going to put you in the community. Your first authorization for mental health is going to be 12 months. But we have no control over that provider. And if that provider doesn't send in your notes, we don't know what you're doing out there. And so a lot of times we get veterans called that are frustrated. I'm frustrated for them, but then we find out that they were seeing someone 2 times a week for 2 hours at a clip, billing the VA and not sending notes in. So then when they come back to the VA and we want to reauthorize that person, and there's nothing to show that something actually clinically significantly happened, it's hard on our end to say, oh, please go back to this person. Typically we'll do another 6-month authorization, but if that behavior continues because the Optum providers are not credentialed to the degree that the VA people are, it's very challenging. And I'm just giving you that perspective because it's something that we're trying to protect evidence-based practices for certain diagnoses. That being said, I just wanted to offer that perspective on it. As myself, I'm a prosumer. A prosumer is someone who works in their hospital but also receives services there. So I've seen it on both ends. And I agree, walking into my work every day is stressful. I don't like it. It's uncomfortable as a woman to work there. But I have to keep that in the back of my mind and make sure that our mental health program service is rendered also can see it from that perspective and offer an environment of care that is welcoming, and if not necessarily, like, we can't paint everything, but that the people know that, our employees and our colleagues know you work here to serve that person. That's it. And so thank you. I just wanted to share that because you all hit on so many great topics up there.
I think
just
Dr.
wanna
Christie had a question,
I just
so I'm
want to
coming over
interject
to you
one
next.
thing first, and this is to Alicia. Community care is awful, and that's not a reflection on it's awful. It can take 3 months to get that referral and get it approved, and if you only have 12 appointments, you're finally starting to feel better with your chiropractor, and then it takes another 3 months for you to get that referral done. So if there's anything in policy, and I used to say this when I was at VA, the weakest link at the VA is community care. They act like you're asking them to do something special for you. They act like you're asking them to take the money out of their own personal pockets. They take forever. It's just an onerous, painful process that is a barrier to care. People just say, to hell with it, I'm not going to go.
Well, can I clarify, because I'm interpreting, so tell me if I'm incorrect, but you're saying that the process from your doctor at my doctor at the VA to do a referral for me has to go through the VA community care process. You're not saying community care on the outside what that is,
Just-
but
yeah.
just getting that bridge.
Yeah, just getting-
3 to 6 months to get the referral
Yep.
for chiropractor after I did 3 sessions with massage therapy and it was working and I finally could walk again. They yanked it, said, "Oh, sorry,
Yeah.
now you got to try something else."
Yeah.
Yeah,
So
which
then you
is
got to
what-
go through another 6 months of like application process.
yeah, getting that whole thing
It's
done.
horrible.
I just wanted to provide information about 2 resources quickly, and to Dr. Macri's point, self-education and self-advocacy are critical. So there is an organization, Veterans Health and Wellness Foundation. They have an app, and in the drop-down menu, you can get assistance with benefits navigation, disability claim help, crisis support, and they also have a resource tool. So it's Veterans Health and Wellness Foundation, and they have an app. Another one is a podcast, She Wears the Boots. And they have information about both general medical issues and gender-specific care, such as care coordination services for pregnant and postpartum veterans. Now, under
Let's let Maria ask her question, but then we're going to take a break. And so we'll be coming back at about 12, like 12:50, depending on how long Maria's question takes.
My question is, all my services are in the Bronx, New York area, and now since I live upstate, I have a nurse practitioner. That's my primary doctor. But I cannot go to Castle Point where it is next to me, cause I'm high risk, and basically they don't have an emergency room. So I have to go to the regular hospital outside Bassett Brothers and everything. And so I had to change my home attendant services, home care, up to upstate. In the Bronx, I had it for 7 years, and the same lady. And whenever she went on vacation, 2 other different ones came, but same people and everything. Upstate, only in 3.5 months that happened, I have 8 home attendants come to my house and disappear afterwards. And another problem. Basically, what it is, they pay less in the upstate county,
Yep.
and they expect these young ladies and everything with $100 to survive. Another thing is, in the Bronx, they have this policy, though. Oh, I'm sorry. In the New York City, they have these policies where the home attendant organization and the coordinators told the home care person, if you go with the patient to an appointment and pass your time, you just let us know, but you cannot leave the patient in the hospital alone. You have to bring them back home. Upstate, they desperate to punch out at 3 o'clock because they won't pay them.
And this is like a problem with
Yes.
different services and programming
And
in just the
everybody is
same
different,
state.
and
Yeah.
so I tell them, you're going to leave me when I have seizures and everything, and sometimes I cannot find my way home. So now in the Bronx, they made something for me. They saying I just down one for my appointments, and they send an Uber upstate. I get an Uber.
Oh, good.
It takes me straight to the Bronx, and then I have until 5 o'clock in the morning to just press, and the Uber will bring me back home. That way, that in case I don't have a home attendant or somebody with me, there will be I will be there without driving. But it's unfair that these systems don't come across every state. She's here. When I went to Pennsylvania, I talked to her, explained to her about getting home care, and she got it and everything. Now she moved to Ohio.
You
She
gotta
has
move
to start
Ohio.
over.
Ohio doesn't get it.
Yeah.
And she needs it. So how could she work that out? Because
Yeah.
I know when she gets sick, she gets sick.
Yeah.
Because I know her for years. And it's a shame that the system doesn't go from one state to another state. Why don't the VA hospital mirror each other in services and how they manage it? Because then everybody will get the same services. Everybody will know from here to here. They will know how to treat the patients, especially the females that are invisible unless you make a big stink about it. You will not be seen.
And hopefully programs like this can help it be more
Yes.
visible.
Yeah.
So the very last part of this session, and then we're going to go to break, is intentionally the I am not invisible pictures are on this slide. And while that went to the VA for a little while, and then it kind of became less of a focus for a VA, Liz, you will continue it.
Yes, we are, the Center for Women Veterans will most likely be taking those pictures down. And so Jean and I are working on getting them all transferred to a Flickr account so that they will have a non-VA home, if you will, so that it'll last, they'll be there forever. You'll be able to go in and download them. And hopefully, you know, Jean will still be able, if you contact him, he may, whether
We're
he's
working on
allowed.
it. Yeah. So Gene Russell is an Army veteran. He works at the VA, DC VA, but actually at the secretary level
Yeah.
as a professional photographer.
And he took
4,000
most of the I am not invisible.
Right, 4,000 or so, but that number continues to grow.
Yeah.
So Gene was going to be here with us today. Unfortunately, he's not able to be here. But if you haven't had an I am not invisible picture taken, I will tell you the experience is absolutely phenomenal. And we continue, Uniting Us and others are committing to helping Gene and Liz make sure that it continues. And because they tell a lot with just one snapshot.
Yeah, that's
So
true.
we're going to take a break. We'll come back at 12:50 and we'll talk about culture and kind of wrap things up, and then we'll talk about how to get information shared with everyone else and people online. So thanks. See you in 10.
Why cannot those pictures go traveling from VA to VA?
And I would talk to Dr. Christie because that's really a policy issue. And I said something similar.
You okay?
Just trigger.
Yeah.
I am invisible.
I teach courses in advocacy, and what's so fascinating right now,
So
advocacy is a big
I think we're going to go ahead and get started.
We just want to get those of you that are in here, if you want to move to the table, would be wonderful. And
Yeah, you guys come up to the table, please. Actually, my mic is not on.
okay,
Thank you. Please join us at the table. So, welcome back, and appreciate people's flexibility that are viewing this streaming. And as we change people and people are heading out to travel back to their states, we had 12 veterans from 12 states join us, which has been fantastic. But when we're talking about air flights, and we're in Blacksburg, Virginia, which is beautiful, but it's also not easy to get to. And so we want to make sure people get to the airports and what they need to do. So this last session, and we'll wrap everything up at the end, is culture. And it's my honor. I put my name on this one, but really it's Mary Lowell Mayhew that is the one that is leading this session. And really, it takes information from the other two sections that we've talked about, and then talks about the people. Ultimately, what we're doing is about the people. What you're seeing in the video, or in the picture, these are women, veterans, all ages, all services, starting with service in 1944, and some that just have gotten off of active duty. And as we grow this, and as it's become apparent to me today, there's a need to not just have it be information and conversations with veterans. Active duty needs to be part of this. And that's to help them navigate, them being active duty men and women, navigate, know what policies are, and if the policies are not being implemented properly at their specific location, that they can be leaders to help it be resolved before someone actually becomes a veteran. So with that, I hand it to you, Mary.
Well, thank you. I'm going to enjoy this discussion because when I think about culture, one of my first things that comes to mind is, I don't remember the Virginia Slims commercial, "We've come a long way, baby."
Yeah.
And I think it's good to see we've come a long way, because when I entered the service around 1979, 1980, so few positions were open to women, and it really restricted my options and my ability to do certain things. Whoops, I lost my mic. Sat on it. Let me go ahead and take care of a technical problem here, and then we'll go. I'll go ahead and start over. So one of the things I want to open with is when I think about, unfortunately, a cigarette commercial, Virginia Slims commercial, I'd like to open with "We've come a long way, baby."
Right.
And I think that's kind of the good news. And I look at when I entered the service in 1979, 1980 timeframe, there were so few positions open to women. And other than the nursing corps, before that was really the only avenue to success, to make rank. And that's changed now, but it took a long time, almost 40 years, or more than, almost 40 years, from 1980 around that time frame to 2016 when we finally opened all those positions to women. And that's the year, of course, I retired because I ran out of runway. I think that's the good news. We've broken down a lot of barriers and we've done them, but it's taken time and it's been painful. And there's a lot of women in this room and a lot of women that came behind us and are still with us that helped shape some of that, and that's the good news. But the challenge is we have a lot more to do. And when I hear some of the challenges we're facing, the big question is, how do we going forward build better leaders and build better service members? When I hear that we're still having challenges with access to care, sexual assault, what are we missing? Okay, those things shouldn't be happening. We should be making sure when our service members come in, they understand and they adhere to those service level values. Sexual assault's not permitted, but it's still happening. Why are these things still happening? Why aren't we doing a better job to care? Are we developing our leaders and encouraging our leaders and our service members to advocate for themselves and to ask the hard questions? And I look at our cadet programs and our service level academy programs, and I think this is where I'm grateful for being here today and having the time with those young leaders, because they asked some good questions. And I think that's one of the things when we talk about influence.
Right.
They need their influencers. I asked an interesting question to them today. How do you get your information? What influences you? And I was kind of surprised that a lot of them, social media. But it's, podcasts and Instagram.
Instagram was the big one.
And I thought, wow, nobody's really listening to the big news the big news podcast. Nobody is really getting both sides of the story. Out of the probably 15 young men and women I spoke to, probably only one of them indicated, it was a he, that he really tried to look for both sides of the story and really tried to dig deep and looked at vetted news sources.
Right, vetted.
Yes, and not Instagram, where people can say anything. And I'm worried about going forward and the impact of cultural changes and cultural practices that can push us back if we're not getting the right influences out there. And I think that's something we're going to need to be paying attention to going forward, looking at where those influences are. The other thing that was kind of interesting, Anne-Marie, and when I talked to so many of the young men and women why they decided to join the service, a lot of them came from, I'm using this term very broadly, warrior families. Families where there are already service members influencing them. And going forward, are we bringing enough people outside that warrior family to help making sure that we have a diverse population with different ideas and different viewpoints?
And not the traditional mindsets.
And not the traditional mindsets. I read a book some time ago about the importance of diversity and the importance of having diverse teams. And the success of our nation has been about diversity, bringing in those diverse ideas, bringing in diverse thoughts. And I'm hoping we don't lose that going forward, because I think some of the greatest leaders have been open to other ideas, bringing in the quote-unquote disruptors, and I was always one of them.
Well, you demonstrated that with the microphone. I'm like, yeah, that's usually me, by the way, so thank you.
Well, one time, one of my funny stories, I was out, I was doing an assignment in the Middle East as a special envoy to look at some of the challenges our service members, specifically the Guard and Reserve, were having integrating into the active force when they were deploying into theater, because we had changed the way we were doing our deployments and then pulling in a lot more Guard and Reserve to enhance our brigades that were going into the war fight. And there were a lot of issues with the integration. And I remember General Blum came in to see how I was doing and goes, "Are you stirring the pot, Mayhew?" I had to affirm him that I certainly was. But I think it's important to do that, and making sure that when we think about that, I felt empowered at that moment because somebody had my back.
Right.
And I think when we're looking at developing our young leaders, making sure they have that advocate to cover their back. And that was not the first time General Blum covered my back.
Right.
Okay.
And there's other leaders, right?
There's other leaders
that
out
we've
there
had and experienced. I may have been a disruptor as well.
I'm so surprised.
I know, it's really surprising. One thing I want, the people that are listening in and that will have a chance to hear this didn't have the opportunity necessarily to hear the discussion that we had with the Corps of Cadets, Virginia Tech Corps of Cadets, 1,300 students yesterday, a beautiful auditorium, Burrs Hall, and we imagine this, we ran out of time. There were a lot more questions, which we were able to cover a lot of those at breakfast this morning with the Corps, but 3 questions, 3 different demographics of people that stood up and asked questions, and they all were very thoughtful and careful on how they worded questions, not to offend anyone. And what I found most interesting is the question about DEI that the last gentleman brought up, and how to support it basically without getting into trouble, right? Like, we know that a blended force and a diverse group of people have, from all walks of life, bring in ideas and thoughts and problem-solving capability that we wouldn't have if it was one demographic.
Yes.
And so I think an issue that we have with culture is you have culture that exists, and then you have what the organization wants as a culture, and then you have what the younger generations are bringing in, and how we kind of sort through all that and say, okay, here's a path forward.
Yes.
But they're asking the question.
I know, they are.
And he's a junior.
And I think that's a good question. And I think part of it is, meeting people and organizations where they're at. I think that's so important, understanding where you can influence and making sure that adheres to the service level values. Because we're getting rid of some of the programs, DEI, it doesn't mean that we shouldn't be supporting the service values of, and respect.
Right.
Okay, and honoring each other and respecting each other. in some ways, if we had an ideal situation, we wouldn't have to have advocacy for women because we would be already equal. We wouldn't have to demand some of the things we're doing, or we're demanding, or we wouldn't have some of these things in an ideal world, but we're not there.
But you know what? We're making progress,
We are
which is what
making
you
progress.
said.
Yes,
So Virginia Humanities read this proposal that actually Army veteran, retired Lieutenant Colonel Dr. Jim Dubinsky, I did it. They picked this project, and Virginia Tech, actually multiple departments have been involved. We've worked with the students, we've met with the Corps and working with them now moving forward. And it's partially funded
Yes.
by a state and by the women veterans, and we have male veterans in the room with us. We've
Which
had
is
men
important.
and women all week, but here's the question that I have for them. So Ryan Hinley, thank you for being here from the DCVA. And I'm sorry, sir, I don't want to say. Yes.
Dave.
So can you hand the microphone, Joe, to any one of those three gentlemen, because Ryan, if you could share with me, you're a Marine veteran. You actually are very engaged with younger pre-service people, young future leaders, and also with veterans through the programming that you've done. And so I would love to hear what your thought is on how we can continue to make progress, regardless of some words or what current administration or what's happening politically or whatever in our nation, but what we can do to maintain.
Build better leaders.
Yeah, build better leaders. And for veterans to be able to support that.
Thank you, Anne Marie, and thank you for inviting me to this event. This has been amazing. I think it really starts with events like this. When you told me about it a few weeks ago, I thought it just sounded just incredible. I haven't, I think intergenerational learning experiences like this, where veterans can talk to future service members, current service members, I think that's really valuable. I was telling some of the cadets this morning that when I got out of the Marine Corps in 2013, I did TAPS. TAPS is fine, but I still didn't think that a lot of the resources that I learned about were for me. I did 5 days of classes, an overview of the benefits, but I didn't think a lot of that applied to me as a veteran. So when I got out, I had about 5 years where I really struggled with various things, and just that it never occurred to me to use any resources that I had available the entire time. And now I work at VA, and I've previously worked in a VA PTSD counseling program called the Vet Center. Lauren Emerson also worked in that program. Chris Davis worked there as well. So working in a resource program like that at VA, a big part of it for me, so that program works with veterans as well as active duty. So I did community engagement for the program, and I'd be in the community talking to current service members in their early 20s. And I would always tell them, I know the military culture is changing and has changed a lot since I was in, but if there's still any stigma against accessing resources, particularly mental health resources, please, I tell people, please use the resources that are there. Don't be afraid to use resources, and just if you need help with something, don't be afraid to get help or ask for help. There's a lot of vet centers, for example, are designed to be very confidential. So you can, an active duty service member can go to a vet center, get counseling, and that the clinical reporting system they use is separate from the main one VA uses. It's self-contained, and it doesn't report back to DoD. So it's meant to be a protected space for people to access a resource. So I always tell people, and I was telling some cadets this morning, please use resources that are available. Please get help. And I think events like this one, where cadets can talk to veterans like Colonel Mayhew. I mean, I think just the transmission of knowledge like this is really important because there's all things, we can all look back on our careers in the military and think like, oh, this could have been different, or I wish this had been different, or I wish I'd known to do this or taken this opportunity. And in fact, often, as we've been discussing in this conference, that there were there were limited opportunities, particularly for women veterans. So, I think it's really great just to educate future leaders like we're doing here. So.
And then if you can pass the microphone, sorry, to Dr. Dubinsky.
You good? Oh, no.
I would certainly
All right,
echo everything that Ryan has said. And there is that stigma. And even I work at Walter Reed as a social worker, particularly officers, and they'll meet me in internal medicine clinic, and then we'll meet, I'll do a quick assessment, and then I often refer them to things like the vet center, because there is, especially in higher leadership, there is still that little stigma. And when somebody active duty walks in, you have to report back to the chain of command, regardless who that person is.
Right.
And I think it's giving them that little privacy to say, hey, go to a vet center or use community resources that they're able to obtain. But they may, and the big thing, they're like, what is a vet center? Am I allowed to go to it? And I go, yeah. It's for active duty. Congress authorized it, blah, blah. And they're able, and they often come back and are like, thank you. And then we also see, the majority of my patients are retired female active duty members that are now veterans that didn't address mental health or issues because they were afraid to. So I'm glad that we were able to, at Walter Reed, to give them that resource.
Yeah, it's fabulous, and I wasn't aware of them until I met Ryan 5 or 6 years ago. So it is a phenomenal resource, and I'm so grateful that you were able to come down and spend time with us. So Dr. Dubinsky.
I was just going to step in and say something really quickly.
Yes.
Chris sold himself short a little bit in that, because at the vet center there were zero at that point in time in Silver Spring. There were no female clinicians, and I think historically the approach has always been have a female clinician be the MST provider. And what's interesting and unique about the vet center services is that we do not have the same eligibility criteria as big VA. So we would have service members come through the door that served, maybe they didn't get through basic training, maybe they didn't get through AIT, but they have military sexual trauma. And so they can receive services there. And then simultaneously, a point I wanted to mention earlier is that Chris and our other colleagues would not help with a claim, but help support a person submitting an MST, a claim related to MST, because that process is gut-wrenching. And so you're working with someone, the VSO, and then they're going to say, you should write an impact statement. Well, you don't want anyone doing that on their own without mental health support.
Right.
So Chris did that, and our other colleagues at the vet center did too. So he was selling himself short here.
Well, that's a valid point. And one thing that I think we need to recognize culturally is when we do events, we have healthcare providers with us, which actually you heard a couple of the doctors talking today. And we have a lot of veterans that are involved in mentoring and helping both active duty and veterans that have been trained and gone through specialty training and support so that they can help people go to a writing workshop and write safely, right? And when they leave, they practice how to come out of the deep, thought process that they were in. But it's critical.
The whole healing arts.
The whole healing arts.
Yes, which I think are so important to help people tell their stories, whether it's through writing, poetry, or pottery, or glass,
or dance, or theater,
dance, drawing. And I think that is such an underutilized source for people to help with the healing process and then maintaining resiliency. And I know this year at our symposium we talked about the difference of the therapy, with the healing process, and then places like the Smith Center that help you retain that wellness and
Right.
retain that health.
And a place to go.
And a place to go.
Right.
Yes, to maintain the health.
And so Dr. Dubinsky has been here at Virginia Tech since, did you say 1998?
Mm.
So you've seen it and you've built programs here, but you're part of this initiative and we're sharing it with others, hopefully sooner rather than later, not 2 years, 3 years like Penny said. How do you see this, and especially culturally, because you taught at West Point when you were in the Army. You're here now, and you've been a civilian. You have 4 grown kids. Please share with us.
Well, there's something I want you to touch on when you're sharing your thoughts, because I'm going to pull Ryan's intergenerational thing. And something that you do here that I think is important, because we've talked about diversity and bring in different ideas and different thoughts. One of the big things is that as veterans in the military, it's just not the military that takes care of us. It's all of the communities, all those other agencies that have to work together. And they have a very special program, I think, is really an important model. I really want to pull the threads on that a little bit and talk to, I'd like to, when you're talking about some of this, I'd like to talk about that program a little bit.
Okay, I'll do my best to try to address. First, I feel privileged to be among all of my fellow veterans and to learn from them. One of the most important things I can say that I've learned in my long career is to listen and seek out stories from a wide range of audiences. And so one of the things that I noticed here, although we could still do better, we had a wide range of people who were involved, and that is women from all different branches, women from different generations, and women who really, the medical corps side of things and the combat arms side of things. We had our Marines and therefore are enlisted as well, right, and our officers. And we need to do more to gather the voices of the enlisted soldiers and sailors and airmen and Marines because they form 2/3, 3/4 of the population, if not more. I'll just give you I guess just to try to go to Colonel Mayhew, Mary Lowe's question. So when I arrived here, I was still in the reserves, but I was trying to build a program, and I was trying to teach my students how to live out the motto of the university, which is ad prosum. And it was a writing program, and I said the best way for them to do that would be to engage with the community. And so I put them in, I connected with nonprofits all across the community from '98 to 2007, and I probably had between 35 and 40 different partners, and my students wrote grants, or they built websites, or they wrote annual reports, or they did all that material. And I was also on the board, I got on the board of a couple of nonprofits, and I was involved in something called the Third Thursday Society, which was run by, again, so powerful yesterday listening to Dr. McCree, but Andy Morikawa, whose parents had been interned during the World War II, and he was the director of the Community Foundation, so to get to the community. And he would hold these meetings every third Thursday of all the community leaders, and I would attend, and I'd be one of one or maybe two Virginia Tech people there. The shooting tragedy happened on 4/16/2007, and it just so happened that I was in the middle of a special project of a task force to help the university figure out what student engagement was. I guess because I had been doing all this work with the community. And so our recommendation then became very important. It was to create a center and for engagement. And I think the best way to put that out is that the third Thursday meeting, which happened the next Thursday after the shooting tragedy, was at the library, the public library here on Draper Road, and there were 65 leaders from the nonprofit community and me. And all they wanted to talk about was how they could help the Virginia Tech community, and also thinking that this tragedy extended beyond Virginia Tech, because all of us lived in Blacksburg, and all the people, because students were killed, faculty members, friends of mine were killed. And what they wanted was a window or a door. And so that was what our recommendation was, to create this center, which is now called VT Engage. And I stepped out of the department for 3 years to build that. But what I learned in that process was what I'm seeing happen here. I guess that's, we provided access to resources that, particularly students who are going to, and I said to them, I said, you're going to be at Virginia Tech longer than I was at almost any place in my Army career. You're going to be here for 4 or 5 years. I said, and you don't even know, you should know what your community is like. You should feel, most of you live off campus. You need to find out what Montgomery County is like. You need to find out and you need to be a part of that. And you need to invest in that. And if you do that, then you can live out the motto of PROSIM, which is that I may serve, and there's a leadership component to that, right? So I wanted to help them become leaders in the community. And once I got sort of the center off the ground, the vice president, whom we actually met yesterday, was John Dooley, wanted me to stay, but I wanted to come back because I was seeing all these young kids coming back from Iraq and Afghanistan and coming to school, and they'd seen 4 and 5 deployments, something that was unimaginable in my career, right? And I realized that we were not putting the resources of the university, which I mean the research and the teaching resources, to work in the way that we did in the 60s with creating women's studies, and the way we did in the aughts, with LGBTQ studies. And so we helped build a community that we called Veterans in Society, and now we have a Veterans Studies Association, and we have a Veterans Journal of Veterans Studies housed here at Virginia Tech. And that's another way, I guess, to, and what was really interesting is listening to my colleague here, Dr. Christie, speak and drawing from academic resources, right? Drawing from studies, right? And you have to it has to be empirical. It has to be quantifiable. It has to be verifiable. People aren't going to listen to it if it's just a story. So you have to combine the stories with the data. You have to. So what we're doing here is starting to build a resource. I guess that long story short, and I haven't said much the whole couple of days, but this, so I will stop after this. Is to be a part of this group to try to build access to this part of the population that I mentioned yesterday that has so often been excluded, ignored, and the whole point of the fact, not invisible. I helped some colleagues in the community build a dialogue on race, and one of the community, because there are only African Americans are 4% of the Montgomery County, and my colleague who asked me to help was the first African American elected to office, and she was a forklift operator. So she didn't even have a college degree, but she kept saying, Jim, we need to find a way to make us visible, because people don't even know who we are, what our troubles are. And one of the ways we did that was we went to all the boards of directors of all and we showed them on a draft all the different heads, and almost all of them were white, or maybe 1 out of 10 or 15 were black, and that was a way of highlighting exactly what you're doing with this. So the point is, this is good work. There are excellent leaders among you. You've already started all these powerful projects, and we are going to maybe be a window for all of that work to a larger community that then can do sort of what VT Engage did for the New River Valley. This can do for the larger veteran community, particularly the women. So I guess that answers the question.
You can pass the phone to Ann, or the microphone to Ann. But one thing to say, Jim, is you are exactly right. You are a window, but you're the host of the house that's going to hold this information so that people have a place to go. And so thank you for sharing your home with us, and we look forward to the students have been phenomenal to work with.
And I also want to say thank you to this crew that's
Yes.
in here working today, because again, I'm privileged to have friends like my colleague Jason, who's not in here, who's doing oral histories, and my colleague Joe and his crew. And you're right, I have access to tremendous resources, and learning to take advantage and reach out and build partnerships with them has been part of the learning experience. And clearly, you're an expert at this.
No.
But also, too, I think the thing is, to develop future leaders, you need those programs where they can integrate people that are learning. And I think, when I was in OSD, we often had families come to us whose children wanted to serve, but they had disabilities or didn't meet the physical qualifications. And there was one young man who was deaf, and he really wanted to serve in the military. And we kept saying, well, you really can't, because you have to be able to hear and hear commands and everything else. And there was just you couldn't accommodate the person. But they still want to be able to know how to serve. What is the military life like? What are those issues? Where are those connections? And so by developing programs where they're going through the ROTC program here and then going off to civilian agencies, I think is an amazing model. Because not only they have a cohort they can reach back to, there's connections both ways, so that as those military leaders are moving up through ranks and they see issues, they have other leaders in other government agencies they can reach back to and say, hey, have those conversations. And when you have those connections and conversations, it's huge. I was fortunate that I went to the Eisenhower School, which is one of the senior service colleges. And it's really the only senior service college that integrates civilian agencies and private sector organizations to really collaborate on how we build our U.S. national power. But if you don't have the building blocks back here at the university level, it's hard to build those leaders up here. I think this is an amazing model, and I just wish there were better ways of exporting this, so that, because I think it's phenomenal, because we have to goes back. We've come a long way, we have a long way to go. It's about building leaders, and a couple of you have said it's about leaders. And if we don't build those leaders and train them and educate them and have those conversations, we're not going to get to that next level of cultural change, and it shouldn't take us another 40 years to get to that next level.
Well, and so this morning when I was leaving the core building, and I haven't given it to you yet, but one of the instructors brought me a card, and he was looking for you, and unfortunately you had already headed over here. And he had met with cadets early this morning, and they gave him feedback on our session yesterday. And your experience as a helicopter pilot, as a veteran, what you shared with them was, I mean, he was so grateful for the opportunity that he gave me his card, and he said, well, we need veterans to tell their stories like this and to join groups like in our community. So he has a writing group that he's part of. It's a book club. And I will give you his information. And he just wants to figure out how to have other people from other types of career fields, different services, be part of the bigger community. And speaking out is hard. I mean, it's emotional. There's a lot that goes with that, both in preparation and in after the execution of what you've done. And so as we talk about culture and being a writer like you are and a leader, how do we address it with the cadets, for example, that you interacted with yesterday and today, because I saw that you talked to many, and how do we as veterans give back to the community, but then also gain from the hope and inspiration that these bright future leaders, and in some cases they're already leaders, are providing us?
Well, I think there's a reason they talk about the pen being mightier than the sword. And I feel like I was born a writer, and my life took me on this journey through military service to give me experiences to be able to write about and then share them. And nothing gives me greater satisfaction than to be able to share experiences and kind of time travel through, because there was a time when I was a cadet, and it puts me back in that headspace of what did I think about then. And I've been saying in therapy lately that I feel like my life, in terms of a season, has been it's been a very long, brutal, and bitter winter since 2010. That's when my brother died unexpectedly in his sleep. I had to have brain surgery for the pituitary tumor, and my marriage fell apart. And since then, I feel like the season in my life has just been a thick blanket of snow. It's not to say that there haven't been wonderful sunshine and beautiful rainbows along the way, but if I were to define that season, it's like it's been winter. And blizzard after blizzard. And up until 2010, it had been spring and summer and spring and summer. I really hadn't had any setbacks. I hadn't had any real life challenges to speak of, which I think is the cadet. I mean, not that we don't have life challenges, but we have the resiliency to deal with them. That we don't even realize that we're getting down and getting back up. We don't even realize that. And so there's been this long, long, long winter. And we can help each other through that, but when it's winter, it's winter. And it's only until recently, my life kind of went into a blender over the summer where all the dominoes fell again with health, relationship, you name it, kind of everything fell apart. So I moved. I physically moved out of state and kind of like restarted myself. And it wasn't until October that I started getting this whiff of spring. And I can't describe it any other way than that. It was like a familiar thing. Like, you ever see a dog like lift its nose up and you're wondering what in the world is that guy smelling? Like, what is it? And what is it? Because we can't smell it, but they're smelling something. Well, it's like I landed in my condo and there I am unpacking boxes that I had had in storage for years from my divorce era, the week of my suicide attempt. It was like, I would think to myself, I'm gonna unpack this stack of boxes, but it was like opening up an Easter egg. I didn't know what was in that box, and I would pull that box down, and there's the helmet bag that after my suicide attempt, people packed up and put in, and I thought, holy smokes. And I unpacked that bag, and there were referrals to doctors in there. There were notes from my classmates in there. There was art that I had created that week, and it's like I'm doing this autopsy on myself that week. And I had so much compassion for myself. It's like, you know, when you're in life, like these cadets are in life, and when you're in life, it's like you can be in a pool that everybody's pissing in. It's yellow, but you don't realize that you're in a pool like that because you're going through life. And I now, having kind of decompressed myself and went through tons and tons of therapy, well over 10,000 hours of therapy, I look at these boxes and I had a whole different perspective for myself of like compassion and grace, and really felt the support and the resources that had helped me along the way. And now it's like, I don't know, I was saying this morning to the cadets that, you know, a mentor told me years ago that corn knows how to become corn.
I love this story.
It does not need any instructions or help from anybody. You plant a seed of corn and that thing is going to become corn. It's brilliantly intelligent. There's like not any more complicated than that. You plant a sunflower seed, you're not going to get an ear of corn. You're going to get a sunflower. So I feel with this spring kind of coming around the corner that I'm going to turn a corner, and I feel like I'm in a stage of life where I have no idea what seeds I planted 20 years ago. And I'm going to turn the corner, and it's going to be like the most surprising thing in the whole world. I don't know is it going to be sunflowers, corn, avocados? I have no freaking clue. And when I think that's how life is, like the pilots that want to become pilots, I thought to myself, I didn't always want to become a pilot. It was like not even on my radar. But the path that led me to that was like, it's like so full of mystery and miracles that it's like, even the greatest writers of all time, I think that's what they try to accomplish, is to articulate that and illustrate it. And even the most brilliant writers fall short of it. And so, and culture, I mean, we have such a rich culture, and particularly in the service with the uniform, and wanting to keep that alive and transmit it and pass the legacy on. But it's like we're all gonna become corn because the seeds were planted. Mm-hmm. There's just no ifs, ands, or buts about that. It's just gonna happen. But we don't have any control over the timing or the season. It's like we put our nose into the air and we smell it or we don't. And thank God on the days that we smell it.
And she shared that story with our table this morning. I love that story. And I said, I'm going to remember the corn story.
It's more than a story.
Yeah.
Well, it might be an avocado or sunflower.
I might be that sunflower growing in the cornfield.
So I've been listening to these stories about these incredible programs like the Smith Center, like the Vet Center, and programs at the VA, programs at Walter Reed. And there is a plan to cut 80,000 positions from the VA. Let me say it once again, 80,000 positions. And so I think we have to prepare ourselves for the fact that many of these programs may not be able to survive, or they may be decimated. And I think it's important to look at a strategy to survive that, identify organizations that we can contribute to, processes that we can use to ensure the survival of these critical programs. And if you're not okay with 80,000 positions being cut, you can reach out to your elected officials, and that number is 202-224-3121. 202-224-3121, and let them know what you think about 80,000 positions being cut.
Can you say the number one more time?
202-224-3121.
But I think to the point too, how do we strengthen at the programs at the community level too? Because I think it's just not the federal agencies we need to be thinking about, it's our state agencies. And in many ways, I think the state veteran organizations are very powerful because they have a much better understanding of what those community needs might be and where the gaps are. And I think, if things aren't going to be as strong at the federal level, I think this is where we can make an impact working with the state level organizations, which truthfully are in many ways closer to the community needs and understand those community needs and can do a better job of getting people to work together, because I'm a big believer in public-private partnerships. I've never been a big believer that federal agencies should be responsible for everything, but they have to have smart policy and make sure that they're resourcing things at the right way. And then same thing at the state level. But it really needs to push down to those community levels. One of the things I think we're lacking though is what does a healthy military and veteran community look like? What are those things and those services they should have in place to make sure they are veteran friendly and military friendly? And I have seen that it's all over the place. I look at states like Pennsylvania that offer some pretty good, strong programs. Maryland does have some good things. I live in the district, and I would love to help the district be the role model, but I've reached out to them, and I'm waiting for the call back.
Well, and Virginia, we're here because of a state program.
And Virginia's a strong program.
Yes. Yeah, not so much about Virginia Tech, but I just wanted to say that, we are watching, I think, Dr. Christie's point about this incredible cut that's threatening. And that, of course, as she said in private conversations, about a third of the people are being cut are going to be veterans across the government. So this is doing damage to veterans in terms of their care, and also damage to veterans in terms of their well-being across the country and their families' well-beings.
And damage to the employees that stay in place.
Right, and
Yes,
so
putting
this is
additional burden
but
on them.
We were fortunate to be supported by a state-level organization, Virginia Humanities. Just recently, they sent out an email, and they talked about how 85% of their funding does not come from the federal government, so they were still going to continue to stand behind the kind of principles that they have advocated for, and they're not going to get rid of words like advocacy and diversity. And I just wanted to mention to your point is that there are, I was at a National Humanities Council conference, National Humanities Conference in Providence, Rhode Island, and I got approached because I was talking with the program officer from the National Endowment for the Humanities about the work we had been doing with veterans, and she had been helping to sponsor, which is how I had a chance to teach and how I met Anne Marie and one of those things. But the point that they were all interested, they too, as North Carolina, West Virginia, South Dakota, they were all interested in that because they thought that their states could and probably would continue and would like to find more ways to support veterans and their families. And so I believe that even if the federal government does cut, to your point, there probably will be support at state levels of humanities at every state, and are in the Marianas and in Guam. They were all there. The other point is that I couldn't say it as well as Anne said, which I told her that she was in the class, she's one of the finest writers I've ever encountered in all the years of teaching that I've been doing. And the humanities are really important, and the arts. The humanities and the arts are really important as part of this. And the fact that we have all these organizations that are working together, whether they're dealing with trauma counseling, whether they're dealing with pregnancy issues, whether they're dealing with medical. The point I heard yesterday is that you can't separate the body and the mind, and the humanities and the arts help the body and mind express itself to a wider audience. And I think that we need to keep these kind of events. And it was just wonderful hearing about the hot glass work again. So I'll just say
because
with that,
of the torch
I'll
story.
just say with that is that these are important. At a university that's particularly involved with the STEM side, it's still important to realize that the arts and humanities cannot be
STEAM, not STEM.
Yeah, well, it cannot be ignored,
Right.
because they are the ways in which we keep our cultures alive. And with that, I'll turn it back to whoever.
And I'd like to actually STEAM-H, so we don't forget about the history and humanity, so we don't continue to repeat our mistakes.
Yes.
But to that point, I think it's when we think about the whole picture and the whole person and whole health and our whole communities, we really have to understand how all of these things fit together in that big puzzle. And if you're missing the puzzle, you don't get the full picture. And that full picture is important. So making sure all these programs fit together, whole picture, and that that the pieces is so important. And like you said, this is where we can have those discussions. We can be the influencers. We can help shape the next level of influencers with the education programs at the universities, and that's why I think things like this are just so important. It was such an honor to speak to that next generation of leaders. They're going to be the ones in 20 years making the policy decisions about me. So I want to make sure that we're preparing them well. So I think this is such an important opportunity.
Well, I learned a lot from them.
Yes.
And interestingly enough, a 12-year-old who came here that thought Virginia Tech was cool because of the great engineering program, after having breakfast with the cadets and interacting for 2 days with them, has decided not only is a phenomenal academic institution, but it is a phenomenal leadership center. And it's centered around the Corps of Cadets, the civilian program that they have, and had actual cadets telling him, well, make sure that you do this, between being 12 years old and 18, so that when you apply, you have got these types of things on your resume. I'm like, my job as a parent, I mean, that's it. I mean, it is gospel.
What about
now.
the other 12-year-old though?
Well, she's more of arts and not the engineering side, but she has her turn too. Don't worry.
Okay, yeah, we're gonna
We
get her
gotta
too.
we gotta get her too.
We'll get her there.
But Annette's also there with us all the way, and so I think she has a strong association with arts and humanities. But that's the value, and without these discussions or images that cadets can look at, I wanted people to see this, and Alicia's here. She's Dr. Christie. She's the one that is our Uniting Us lead on this. Annette Poland is so generous to be with us, guidance and support and insight. But we look at the pictures, and these are all women, but 8 women died in Vietnam. They came back, all the women came back from Vietnam. There are about 11,000 that served in Vietnam. And people would tell them, you weren't in Vietnam, women were there. Well, they were. But sometimes the arts and humanities give us the ability to be heard in a way that in our voices we can't. So I read a poem or I see a piece of art and I'm like, hold on a second, what about the person in the scrubs in the top left? Well, that's Vietnam. It looks like a medical provider and it really is timeless. But all these women died in combat. A lot of men have, also died in combat. And we document that. We tell their stories. And it's not exclusive to a single gender or race or service.
Well, we don't want their service to ever be forgotten because they paid the ultimate sacrifice. And we have to continue to honor those, our fallen veterans.
Right. And by doing that, the younger generation can see it and see it in a new light. And as they're leading, they have opportunities now to serve before they enter officially the service. And they're taking it.
Okay. I just want to say, I'm so grateful for Annette's mentorship in this work, and I was going to ask if you could provide the link to her Faces of the Fallen story in images. Thanks.
Very powerful. And so, Christina Helfrich Pulaski, I use the mic.
Oh yeah, she hasn't. We have to hear from you, please.
Yes. And here's the thing: all the different voices, all the different stories, matter. And so we're taking the content that was created these last couple days, and it's been recorded by professionals and phenomenal teams like Joe's here, and that to people. You've been here. You've been at a lot of events and seen a lot of different things, met a lot of different people. What do you think moving forward?
Of women, like how, like
Cultural
historically,
Yeah, and
fit into the picture,
and just in general, as a leader.
Yeah. Well, this is why I like us so much as an organization. Even though I've been to a lot of different programs, because you called me out of the blue in 2020 and literally saved my life because I was in a very dark place. And said, "Hey, can we have one of your
Just ship
pieces?"
me this one piece
Yeah,
of
just
art.
would you
Trust
mind?
me.
Do you mind shipping it? You don't know me, but and I was like, "Well, yeah, sure." I mean, what's the worst thing that could happen? Because I mean, I went through a very dark time where if I didn't box up my stuff after I got out, I threw it away. And it was because when you're medically retired, you get all the benefits of being retired, but one day you're in, the next day you're out, and there's no party. You don't get thrown a retirement party. There's no, 30, 60, 90-day terminal leave. That's just not how it's done. And one day you're in, and the next day it's like, and if you're, not in a great relationship, isn't wonderful, then, I went dark. 5, 6 years, just dark. And it was art that I started doing, and I was never an artist. They called it at the time, unconventional therapies. And I started like I do something, it didn't have to do anything, but something inside me moved, and that hadn't moved for a very long time. So, you know, it kind of got me out of bed. And that's not saying I don't have, you know, trip ups and, you know, end up being, you know, for a little bit. But, you know, I always have had United in Us since you called me as, you know, a backup. You know, you're always checking on me, making sure things are going okay. And
Usually that's us calling to ask you to do something.
and I'm
Always.
well, and it's so wonderful because then you're useful, right? And you're like, someone sees that I have value. And it's very easy when we isolate ourselves, and a lot of veterans, and I've talked to a lot of women veterans, we isolate ourselves on purpose. And we do that because, you know, we're not seeing any value in us, or, you know, we're listening to the bad things that have been told to us, or, you know, we didn't have, we compare our service to other men and be like, well, you know, I didn't fly a helicopter, so, you know, then what I did didn't matter for my 11 years. And I've just talked to women after woman, and it's like, it's not a competition, right? And there's the good times and the bad times. Art can, you know, we're not always concentrating on the bad times, right? Art gives us that, and I'm starting to be able to actually, because at one time I was like, can I ever do anything pretty? Sorry. Can I ever make anything pretty? And you know, it gave me an opportunity to do that, and, you know, get out of bed. And I don't, these types of things, and it doesn't have to be Uniting Us, but any type of organization that, you know, gets you out of bed, and people who have been there know what I'm saying, that gives you a reason to literally live, you know, to literally do something. It's organizations like this. And to have our voices heard, like to have someone say, I'd like to do an interview with you, you know, a lot of women aren't ever asked about that. Like I did a Voices of Freedom one, and that was wonderful, but they only wanted to know about combat experiences. And I was like, well, there's so much more. Like, you know, I was only deployed twice out of my 11 years, so we're talking about the majority of the years where I wasn't. And there's a story there too. And we're just asked. And
Joe, we can come back.
A lot of things I have learned is we have to stop waiting to be asked, right? We have to start finding our people who we can collaborate with, and just do it ourselves. You know, just stop waiting. Yeah, that's right.
Yeah.
I was going through a hard time. This was during my separation divorce. But it is a collage from The World of Beretta. I found a coffee table book called The World of Beretta, got it for $1. And when I opened it, there was the schematics for the M9, you know, Beretta. And I was like, oh, that's what we carried. I'm like, I was like, I had no idea it was a Beretta, because I'm not a gun person, you know. But, you know, we all, well, as you get to a certain level, you get one. And so I was like, I had an idea. And so I used the whole entirety of the book to make that. So the
Self-portrait.
This is the self-portrait of what I was going through. So my hair are the long guns, and I never knew Beretta had long guns, right? So, and like even the face, those are from pages, you know, from the book. So, so now I will do some, I'm working on my art therapy certification online. It's just a certificate. It's not, you know, anything yet, but so that I can, when I'm going to conferences and speaking with my writing partner, who I just illustrated her book, you know, I can do breakout sessions in art therapy to maybe inspire, because the first thing I always get is I'm not an artist. I don't want to do any type of things, you know, and I'm like, you know, just do something that, find the thing that moves art. And I have so many artists, they're like, nah, it's just a hobby. You know, I was just like, no, it's not. That's amazing. And I think we just need to be told that. and
be forced to admit it.
Yeah.
well, and say, you know, if I walk into, because I'm now walking into my VA and I'm not seeing myself represented, women represented, right? And I'm like, all the pictures are of flags or of men in boots or of guns and things like that. And I think we need to get more female artwork into the VAs, but not just that. Each service has an art museum. Like the Army has an art museum. The Marines do too. And, you know, I want to, you know, ask them, in your permanent collection, what percentage of art is made by, you know, women? And it's like, and it's the permanent collections that matter, not when they pull in things, you know, just for Women's History Month or, you know, one of that. And because permanent collections mean they spent money on it, right? And money is where it matters. And, you know, I've been answered to where it's like, because I'm like, there's 19% of women. Well, I know for the Army. So I'm like, so you should have at least 19% of your permanent collection should be by women artists. And they're like, well, that isn't how it works. We don't use quotas. I was like, well, that's what the military, that's how it works in the military. Everything's a quota. Everything is a percentage. You know, this is not hard. There are amazing female artists doing spoken word, doing written word, doing art in all different fashions and forms. And it would be very easy to, you know, start buying up these works, you know, and because it helps. You know, it helps. It helps.
It does.
You're seen and you're recognized, and you know,
it's part of that cultural change that needs to happen too.
Absolutely.
And thinking about making sure that that the artwork is properly representative of the population that they're serving.
Yes.
And maybe not solely about quotas, but also too, is the artwork that we have, is it representing the service members that we do have, to make sure that everyone has a voice.
So here's something interesting. Think about this. The Smithsonian American History art collection is managed by a man that is not a veteran, but the British Embassy introduced Uniting Us, because the British Embassy are very good friends, right?
Right.
So his name is Frank. Frank has said, bring your artists to the Smithsonian, and I'm going to take you into our collections, private collections, and people will be able to see things that are just will blow their mind. And I asked him, does it include women pictures, or, you know, does the art include a reference to women, and are there women that you have in your private collection? And he's like, let me get back to you on that. But he said, I will be prepared when your group comes. So it has to start with Smithsonian's and other locations, because
those civilian
grassroots
institutions.
programs like Ryan Hindley's at the DC Vet Center, he changed the art, all of the art out in the Vet Center.
Right.
Modernized the view of what was shown and representative.
We have this piece too, actually. So Christina gave us a beautiful print of this piece, which is currently at the Center for Women Veterans at Waco. But Christina, thank you. So, I mean, this is a breathtaking piece.
And this is why programs at Virginia Tech are so important, to educate our government leaders about these stories and encourage their diverse thinking, and open their eyes up, because we can't get where without our civilian organizations and our civilian institutions, and making sure organizations like the Smithsonian, oh, well, right, nobody ever asked me, nobody ever challenged me, just like you said, nobody ever asked me, nobody ever asked them, nobody ever challenged their thinking. And if we don't gracefully challenge people's thoughts and help them expand their view, then that's on us.
Right.
Okay, and I think that's one of the things. I was at a luncheon last week, and we had Shawley speak, and one of the things I walked away with is that control what you can, influence what you can. Okay, well, control what you can, influence what you can't. Okay, so if we don't ask the questions and ask the whys, I was always the one, but why? But why? And it helped influence the change, because I was always asking, but why? Well, let's figure out. Let's see if that's right.
Right.
You know, I shared this story. I've shared this with you. I had 282nd Airborne instructors, and you know, I asked, well, why shouldn't women be able to serve in every position? Well, we aren't. They probably can't compete with us. Well, why? Yes, they can. Let's do the two. And I was able to beat them both. They gave me their berets. I gave their berets back graciously at graduation for Bottle Chevas Regal, but their leadership wrote a really nice letter about history taking place that day.
Right.
And to me, supporting and pushing cultural change, challenging their thinking, and getting advocates to help support change.
Right.
And doing it one or two people at a time. When we look at organizational change, we have to kind of look at the people that are going to be in your court and use them as your influencers. And then the people that are kind of on the fence, bring them in by challenging their thinking and show them that this is okay. There's always going to be the naysayers. They're never going to go away. There's always going to be a few people out there. And I've led big program changes. There's always that third back there. Don't worry about them. Worry about the people that you can influence, the people you can bring along, and you can then push that change.
And the people that are growing towards
yes.
the future.
Yes, yes.
And that's, I mean, Jim, I don't know how to thank you for what you've done. In my opinion, and I'm just going to go up to this, the success of the last 2 years of working with you is having a slide like this that we can say, hold on, is that date right? Because the policy was signed on this, but it wasn't until 2 years later that it actually happened. And we heard people saying that. And then the cadets look at it and go, what the heck? You know, look at the Morse code in the background of this. And that was a Virginia Tech English student that did the design on this chart. And she's going to continue to do work, graphic arts work, with Uniting Us. And she said, I didn't know that women couldn't always serve. And she's not connected to ROTC, but a brilliant student and a future leader. And so this has opened my eyes. Virginia Humanities, I didn't really think they'd pick us because we're not a mainstream topic. But with the core behind us, with Virginia Tech, we're here and we're not going away. So thank you so much.
I did want to say as well, Liz Estabrooks, the previous moderator, she has a book coming out on the 18th. I don't know if it was mentioned previously, but the book is called, so Liz's book is called Broken in the Stronger Places, From Resilience to Resourcefulness, and that comes out March 18th.
Yes.
And Christina, could you just share how people can connect with your artwork, like your website?
Oh
or?
my gosh, I just gave you
Yes, something that I worked on when I got into a dark place was I created a website called woundednotworthless.com, and it was for women veteran artists of all spectrums. Because I've had poets who said, oh, I can't be on that because I'm not an artist, and be like, girl, you are an artist, and it's amazing. And so, I mean, I don't have, I always search out and I give my card and be like, get back with me. What Wounded Not Worthless does is I will help you write an artist statement, a bio. I will show you where to go to put, how to, if you have a piece of art, submit it, do a call for entry to get it in an exhibition or an exhibit. And I think maybe I have 7 right now. And then when we get donations or something like that, I've had some that be like, I can't do something this month because I can't make rent. So we're able to then, even though it's not a 501c, because that's impossible for my brain to remember how to do it, and I don't know how you do it, Emery, but you know, but we still have funds that are going to like do art because I'm gonna this month.
And you've helped people, you've done exhibits. So
Yes.
when I saw Christina's art, it was like, and she had, it was a U.S. flag, burned the names in of the women at that point that had been killed in the War on Terror.
Right.
And I only saw a picture of it, but we also saw this Wounded Not Worthless program that she had. And I mean, it was a ringer. It was like, and she actually shared a piece of art that, an original piece of art that's got a value higher than, I mean, than I should be carrying, by the way.
Well, art
and
is
has
subjective, so
continued.
you can make your art worth anything.
No, that's not true. There is that value is for real. But that she was already doing something. Uniting Us isn't about doing everything. We want to bring other organizations, people, communities in and just bring people together in a healthy way that is safe and is accepting, and we can share ideas and respect each other's opinions and experiences.
Right. And if anyone out there, anyone who is a female, you can be any way connected to the military. My Gmail is really easy, woundednotworthless@gmail.com, and that'll get straight to me.
We'll put that up on the page.
Yeah, but thank you again, Anne-Marie, for giving a voice to the voiceless, because a lot of us do it, you know, a great amount of therapy to be able to be here today, you know, and it's very important also to recognize my mom and my grandmother, if I had a minute.
Yeah.
They are. My grandmother's to the far right. She's 99 next month, and then my mom is 78, and she served in the Army Nurse Corps during Vietnam, and like I said, 1969, 1971. And their stories, I'm like, the first thing my mom told me about her being in the Army was, I was never going to tell my children that I served, because that's how horrible people were to anybody in a uniform.
Right.
At that time. And that's fine. I totally get it. You know, people didn't know where to put the thing, and we were an easy, you know, symbol of the establishment that they wanted to break down. And I get it as a historian. But, you know, to have, you know, your mom say that to you, you know, it's like everybody's, you know, all women are somebody's mom, somebody's sister, somebody's grandmother. And it wasn't until Anne-Marie said, that's really cool that you have 3 generations of women.
I didn't know. Christina's like, well, my mom served in the Vietnam era. I was like, that is phenomenal. So 2 generations of women. And then she says, well, my grandmother in 1944, and I'm like, 3-generational family of women in service, right? And so they have been with us at every event. I'm so sad that they weren't, your mother and your grandmother were not able to make it, but you know, they're here with us and their stories are part of this.
Right, and they need to be said because we're losing our World War II veterans.
Could I just say, but because we're almost out of time.
Yes.
Based on another one of the students who was in one of my classes is just publishing a book. She was a nurse in Vietnam. Published one book. It's called Women Under Fire, Abuse in the Military. And the second one coming out is called War. It's coming out, well, actually, today's the 7th, right?
Yes.
Came out yesterday, March the 6th. I wrote a blurb for it. Warrior Nurse, PTSD and Healing. And the first one was Women Under Fire. Her name is Sarah Blum. She's in her 80s, and she's amazing. She was, yeah, you remember, amazing. So, I mean, 2 books that really validate and highlight everything that you've just said. And other people have said about service, women's service in Vietnam.
Awesome.
Anybody else? Okay, I think we have to close up.
Yes, we need to close up. And just real quick, I want to recognize Jason, who just stepped in. Dr. Higgins, thank you so much for the support of your students. And